10 medications you didn't know could harm your liver. Your liver is a powerhouse filtering toxins and keeping your body in balance. But did you know some common medications could harm it? Liver disease is a silent threat, often triggered by substances meant to help us. In Mexico, it's the third leading cause of death. In this video, we will explore the 10 medications that might be putting your liver at risk. Before we begin, please subscribe to the channel and like the video to stay updated with our latest content. Let's get started. Number 1. Paracetamol, also known as acetaminophen. This is an over-the-counter analgesic used to reduce pain, lower fever, and relieve general discomfort from viral processes, as well as mild symptoms of some illnesses. Paracetamol is widely used to relieve headaches and general discomfort, which is why it is common for people to take it without a prescription and in high doses without medical supervision. Unfortunately, this practice of taking paracetamol indiscriminately and for prolonged periods can lead to medication poisoning, which also puts liver health at risk. The effect of paracetamol on the liver is so strong that a third of liver failure cases are attributed to its use. To reduce the risk of liver damage from paracetamol intake, consume it in the correct doses for no more than 7 days. Also, do not exceed the dose of 2 grams per day, and if possible, maintain medical supervision. It is also important to check the ingredients of the different medications you take, as many contain paracetamol as an active ingredient, which can cause you to exceed the recommended dose without realizing it. Number 2. Amoxicillin. Amoxicillin is an antibiotic used to treat bacterial infections, generally those affecting the respiratory system, ears, and throat. It can also be used for urinary tract infections. When combined with clavulanic acid, amoxicillin can have better action against bacteria, making it commonly prescribed. However, taking this type of antibiotic should only be done under medical supervision and by following the prescribed doses. First, because indiscriminate use can cause bacteria to become resistant to the compound. Second, because amoxicillin can cause liver damage. Amoxicillin with clavulanic acid is known in medicine for its negative effect on the liver as it produces cholestatic hepatitis. According to researchers at Povisa Hospital in Spain, liver damage caused by amoxicillin has an incidence of between 1 to 17 patients per 100,000 prescriptions. The damage can also include hepatocellular disease, cholestasis, and cirrhosis. Typically, the negative effect of this antibiotic occurs after prolonged use. However, symptoms can appear as early as the first week and up to week 6 after starting treatment. Although most patients recover quickly after stopping amoxicillin, 7% of cases may have complications such as cirrhosis, the need for a transplant, or death. Number 3. Diclofenac. Diclofenac is a type of non-steroidal anti-inflammatory drug used to relieve muscle pain and inflammation. It is usually available over the counter, so it is often taken indiscriminately by consumers. Among non-steroidal anti-inflammatory drugs, Diclofenac is considered the most dangerous for the liver, as it can induce liver damage in just 2 weeks. How Diclofenac affects the liver is still under study. It is known that there may be a direct toxicity relationship in dose-dependent cases, but also indirect toxicity in dose-independent cases. Moreover, many people have a natural predisposition that makes them more sensitive to the toxic effect of diclofenac, which can cause sudden and fulminant hepatitis without prolonged use of the medication. These types of reactions are known as idiosyncratic, and they are the most common when it comes to diclofenac, according to doctors at the National University of Rosario in Argentina. Since it is very difficult to know in advance who may be susceptible to an idiosyncratic reaction after taking diclofenac, it is best to avoid its free use and consult your treating physician if you notice changes in your health after taking it. Among the most common damage damages after taking Diclofenac are acute hepatitis, chronic hepatitis that mimics hepatitis, and hepatocellular damage. Number 4. Amiodarone. Amiodarone is a compound used to treat cardiac conditions such as ventricular arrhythmia and supraventricular arrhythmia. It is associated with liver damage due to the increase in transaminases, a type of enzyme responsible for catalyzing other organic reactions and often present in liver injuries. According to researchers at Duke University in North Carolina, amiodarone-induced hepatotoxicity is a common complication in those receiving treatment with this drug. The incidence ranges from 18 to 50% of patients under treatment, and the condition appears mildly within the first few days of starting treatment, although it can also appear after months of taking the medication. Although hepatotoxicity usually subsides after stopping treatment, in some cases it becomes severe and can lead to cirrhosis and death. If you are taking amiodarone, talk to your doctor about possible complications. Make sure to monitor your health daily to quickly detect any adverse reactions. Number 5. Alopurinol. Alopurinol is a medication used to treat gout, a disease caused by the formation of uric acid salt crystals in the joints, and to reduce high levels of uric acid in the blood, which can cause other health problems such as kidney stones. Gout can cause intense and chronic pain, so its treatment includes nonsteroidal anti-inflammatory drugs and xanthine oxidase inhibitors. Alopurinol belongs to this group. Alopurinol works by reducing the production of uric acid in the body, so it is used more to prevent gout than to treat it. Prolonged use of allopurinol is associated with liver damage, which can also occur just after starting treatment. Although genetic predisposition has been shown, we cannot know in advance whether we are susceptible to liver damage from this medication. If you are taking allopurinol, consult your doctor about the risks to your liver. Your doctor may request frequent laboratory tests to monitor your liver health. Number 6. Anti-convulsants. Medications used to treat seizures or epilepsy can induce liver damage. Unfortunately, the risk of using them increases due to the need for prolonged treatments to prevent or reduce the frequency of seizures. Compounds such as phenytoin, carbamazepine, and lamotrigine can induce liver damage within a few weeks of use. Therefore, it is necessary for anyone receiving anticonvulsant treatment to undergo regular medical tests to evaluate transaminases and alkaline phosphatase. These tests help assess liver health and determine if any liver tissue damage is occurring. Number 7. Estrogens. Estrogens are steroid hormones used in postmenopausal women. They are also included in birth control pills and gender affirmation treatments. High doses of estrogens increase the risk of thrombosis, heart attack, heart failure, and liver damage. Liver problems caused by estrogens include hepatocellular damage and cholestatic disease. According to researchers at the University of Arizona, taking estrogens can cause an increase in transaminases and Budd-Chiari syndrome, a disease that blocks the veins that carry blood from the liver to the heart, which can also lead to death. Estrogen treatment should be carried out under strict medical supervision, and if symptoms of liver damage appear, the treatment should be discontinued. Number 8. Methotrexate. Methotrexate is a medication used as part of the treatment for breast, head, and neck cancer, as well as autoimmune inflammatory diseases such as rheumatoid arthritis, psoriasis, and lupus. Prolonged use of this medication is necessary to prevent uncontrolled cell reproduction, which also increases the risk of developing liver damage. Although the liver damage caused by methotrexate is considered mild and is detected only in laboratory studies, it can cause fibrosis or cirrhosis if used for years. Typically, doctors request a liver biopsy every 2 years of treatment to avoid problems. However, it is essential that any patient undergoing methotrexate treatment have frequent medical follow-ups to prevent the progression of liver damage. Number 9. Antidepressants. Among the medications that affect liver health are antidepressants. They are used to treat mood disorders such as depression and anxiety and are considered moderately risky when it comes to their impact on the liver. These include venlafaxine, duloxetine, sertraline, and amitriptyline. The main liver damage caused by these drugs is hepatocellular disease, which can be detected through laboratory studies to monitor liver health. If you are under antidepressant treatment, it is best to do so under strict medical supervision and undergo periodic tests to prevent the occurrence of liver problems. Number 10. Statins. Statins are a group of medications used to treat high cholesterol and triglyceride levels in the blood. These conditions can cause cardiovascular problems such as thrombosis, heart attacks, and heart failure. For this reason, statins are often prescribed for long periods. While these medications help improve cardiovascular health, they have also been shown to cause liver damage, especially due to their prolonged use. Statins can cause liver damage in a dose-dependent manner. Although cases are usually rare and mild, it is necessary to have medical supervision while taking them to detect any symptoms of liver problems. If you are undergoing treatment with any of these medications, remember that taking them does not mean you will develop liver problems. However, you should consult your doctor about your risks and have laboratory tests done to prevent the progression of liver damage. This video is informative and not a substitute for medical consultation. We recommend you visit your doctor if you suspect you have any liver-related health issues. Now that you know about these medications, would you continue using them? Leave us a comment with your answer. If you enjoyed this content, don't forget to subscribe to our channel and activate notifications to receive updates on our next videos.